What's going on, y'all? Checking the audio, checking the audio. So what's up? So listen, this might be an hour, it might be an hour and 20 minutes. But I did want to kind of show y'all a slide before we actually move on. Do not forget to look at the description below so that you can get the links to the books that are below. Okay. Um, we're generally just kind of going over a couple of things that we were supposed to go over, and then we're kind of going to move on to the CPC guide and some of the surgical section that we had went through. So this class is, you still got a few more days for the surgical section and integumentary. Okay. Some of you did send me an email in regards to your book, your CPT book, and that's what you're waiting on. That's fine. No problem. We're not in any hurry. Just, get your book and then you can always backtrack. Okay, so your step-by-step book is what you're supposed to have for this classroom. Your CPT book is what you're supposed to have for this classroom. Your Hicks Picks book, your ICD-10, your CPC guideline, your step-by-step book, and your step-by-step workbook. If you are doing medical billing, then you should have your medical billing workbook and your medical billing reading book. Okay. In your CPC guide, you are to go over the surgical guidelines and also the integumentary system. So what we do is we use all of these books and complicit with each other. So if you're on the CPT book and you are in integumentary, you should have your CPC guide open to that section. If you are doing your step by step, then yes, you should have step by step book open to this section, which I'm going to head for mine because it should be open. So your step by step book doesn't have to be 2026. Generally, you're going to get the same information. Okay. Do not forget that I want you to read your guidelines in ICD-10. Some of you are going to be new to this classroom, so I want you to backtrack on some of the chats that we already did. Okay, some of the chats that we already did. Okay, and as far as you studying, just make sure that, I hope you can hear me because I don't have my microphone on. Just make sure you take notes. Okay, take notes, and when you start getting it, you are going to feel so glorified. I'm telling you, because when you get that comprehension down, it's like, oh my God. Then it doesn't feel like the test is going to be so bad. Okay. So again, we are in a step-by-step book, and we're generally kind of going through what's in your CPC guide together with your other books. Now, before we even get into this, I don't know why I pulled that over here. Yeah, and I'm having like a hair complex thing. So before we even get into that, I'm just going to. Now, this is just a quickie PowerPoint. And when I use StreamYard, y'all know I like to kind of do PowerPoints and things with the StreamYard. So, yeah, I know you can do some things with your StreamYard that you cannot do with OBS. Okay, so there are some things that I like to use. So, this is, Sapphire Physician Coding. I'm just going to see if this is working okay over here. Sometimes, I do the class late. I kind of like doing it late, but I got caught in all kind of stuff last night, so I couldn't really like bump in and go ahead and do the class. Uh, but right here is just, pretty much your introduction to my class. Okay. And I don't normally do this all the time. I just kind of do it every now and then, kind of like an introduction. When you guys go on sapphirecoding.com and you do that download, the first thing you're going to get is an introduction. Okay. And the download is going to be that language and medicine book is also going to be in there. Okay. So, Sapphire also does a medical billing. So you guys know I have the medical billing course. It is in the beginning of this course. Okay. Check that playlist. It is in there. Okay. This is your surgical coding class. Okay, this is integumentary. Okay, that is a class number that you see up there. It's class 32. So this class is 6109. So it's CDG 6109. So in your Sapphire classes, when you see those classes in there and it says Sapphire and then it has the CDG, or if it's medical terminology, it has MT. Okay, if it's medical insurance billing, it has MIB and it will have the class code on there. So anytime you're looking for a class that okay, no, I want to just kind of go over that class, look for it from the number. Okay. If you join the Sapphire Academy, the classes are in order. You're going to use those classes with these classes complicit together. Okay. So again, we're going to be doing guidelines and integumentary because we started this a couple of days ago. We are still in it. Okay. I think we'll probably be finished with this section maybe by, okay, I don't know, maybe Friday should be good. Okay, so again, this is Sapphire Physician Coding, and this is the class that you're in. Okay, we just kind of talked about some of the chapters that we are in. Okay, and those of you who are working independently alone, you can just follow what you see on this chat. Okay, so your step-by-step book, chapter 13, your CPC guide, chapter 4 and 5. That's what you should be in. Okay, basically you're just going to make sure that you keep up with your reading and you're going to take notes. Okay, because the CPC guide is your go-to. So some of you who are looking for the brush up, some of you who are just kind of getting back into coding, go on the AAPC website so you can kind of see what they have in there at this time. You remember you can purchase books from there as well. But right now, today you should be in your step-by-step book and your CPC guide. Okay, your CPT book, ICD-10 and HCPCS is mandatory. You're supposed to have that in front of you anyway. Okay, so just make sure you have that. Okay, and when this is finished, probably tomorrow, because they seem to be taking a little longer with the download on YouTube. So you probably can't even get this today. You might get it tomorrow. Okay, but I'll put it on a short anyway, so people can get it. Okay, so those are the books that you're going to have in the meantime. All right. So again, the Sapphire Academy, once you go on sapphirecoding.com, it pretty much gives you a lot of resources in there. You have a syllabus in there. You have all types of coordination with YouTube in which you can pass your exam. Okay, and that's one of the goals that I need for you to make sure you stick to. The class is for you to pass your exam. Now, if you're not heading towards your CPC, that's fine, and you just kind of need to brush up and you're already doing medical billing, no problem. You will not need to do a lot of what the girls are doing in this classroom because they are headed for their CPC. Okay. Also, the medical billing. Just dive into the medical billing class and find what you need to find in there. Okay. So, if you are here, glad you're here. Stick with us. We're getting in the gusto, but again, here is where you are the one who is doing the work. Make sure that you read all the chapters, because what I'm basically going to do in this class today is we're just going to do a rundown of what is actually in these chapters. Okay, you're the one who's going to do the work. So just make sure you archive the chat so that you can kind of keep up with us. And it's not mandatory. You guys are working on your own. You're working independent. But when you watch the chats and then you have all your books with you, you will stay on point with us. Because some of us who have already did the courses ahead, they're already a little bit ahead of you. But again, this is an open class room. You can walk in whenever you want to, because every one of my chats are numbered. They have class numbers on them. So if you guys, when you archive, look at the beginning of this class, you will see the number there. The number is also in the description. Okay. There's always a code for each course. Okay. So focus on the reading. Okay, focus on the reading. When you focus on your reading, that's how you retain. Okay, when you're doing the reading, make sure that you have a good comprehension, because if you're not quite understanding what you're reading, it's going to be difficult. Okay, it's going to be difficult for you to get that answer correct. Whether you are taking a life insurance with me or you're taking any other test, okay, your training modules for the life insurance is the same thing. You have to remember what you're reading, retain what you're reading, understand what you're reading. People have different ways of learning. You all know that people have different ways of learning. You have people that are more visual, people who like to read over and over. I'm like a read over and over person. The first time, all right, I'm just kind of reading through it. The second time, now I'm paying attention. So, and then the third time, I'm taking notes. So you see how that progression is, how I'm doing my study. That's how I want you to do your study. I've always kind of done that, even in high school. That's the way I study. Um, Videos and stuff like that that have information in them. I like to play those videos and have the work in front of me. Especially when my instructor, she's not available. Let's say she wasn't there or she's not there. I never had a problem with emailing my instructor. I never had one that had a problem. And I've always done that with my own students. They know that they can get to me anytime they want to. Okay, so let's move on. So we do 1 to 2 hours on the YouTube. Okay, your theory and your practice. Okay, when we finish with the class, you are the one who do your other practice at home. Your practice is what you are doing in your workbook. And again, we are putting you in the right place so that it feels like you're in a classroom. It feels like you're doing your work. It feels like you're in an online school. Even if you are not in the Sapphire Academy, we want to try to make it as better as possible. Now, I have different streamware. So some of the streamware that I use, this is one of them. When you're teaching the StreamYard, and this is for those of you who are about to do your own business, because I know some of y'all are finishing, got your CPC, and you're ready to kick off your own business. The StreamYard is better when you are teaching because you can also put links, you can also put PDFs, and you can put pictures up here. So some of you who are doing your own business and you just getting it together, StreamYard is your best bet to show any type of illustrations that you want to. Okay, so let's move on. So the surgical section is a must. Okay, read your guidelines in its entirety. Okay, AAPC is going to test your skill level. That's what it's for. They're testing to see if she has actually read through the CPC guide. I can't imagine anybody not making sure that they have taken in and retained what's in the CPC running it. CPT retained what's in the guide and the ICD-10 before they spend $400 taking a test. So that's what I want you to do. And if you want to see what's on the test, go to aapc.com and then you want to click on CPC or you want to click on test. You also remember the chat that we did. When did we do it, y'all? Yesterday or the day before? We looked at the CPC guide and the CPB. Because I know some of you are not going on for your CPC, you're going for CPB. Okay, so again, these slides are pretty much to kind of still help you out and kind of still help those who have just joined the class. Okay, so if you're not sure yet, you're not sure which way you want to go, you're not sure what you want to do, it doesn't have to be coding. It could be, I'm not sure if I want to do this, or I'm not sure if I want to do that. I'm not sure if I still want to be a 9 to 5. I'm not sure if listen, everybody has those type of I'm about to pull my hair out. Okay, everybody has that. Okay, especially now. There's so many people that are starting their own business. The thing about doing your business, you still have to grind. You may still have to do a part-time job. Okay, but in coding, you can trust me. Who's starting at 20? I can tell you right now, I saw something for charge entry is starting off at 27. So you can imagine what they're paying for coders. They got to be starting the coders off with at least 33 or 34. Charge entry, that's she's just putting in the codes. When we talked about in the last chat, that's pretty much putting in the codes. Okay. And like I said, years ago, we didn't need CPC for that, but now they do. Okay. So again, there's several options for you to make money. And yeah, y'all know how I am. When I find out, I'm gonna let y'all know. Okay. And one is you also doing the life insurance or doing the mortgage, the auto, the home security, and those type of things. But that type of thing is for people who are good with sales. Your own business is you must be good with sales. Train yourself to do those sales. So not everybody is a 9 to 5. There are those who like real estate. That's sales. Sell a house, you get paid. Insurance, sell insurance, you get paid. Sell life insurance, you get paid. You see, when you do coding, you're going to work for a hospital, they're going to pay you. Okay. But if you have your own business in the coding, you're going to bust your butt to make your sales. So, that depends, however you want to go, but again, people are at a toss up at, oh my God, what I want to do now. And like I said, a lot of people either, choosing to do their own business. Maybe it's something that you've always wanted to do. Doesn't have to be billing and coding. You just have to make that decision, write it down, figure out what's best for you. And you have to let your faith take over. I mean, you're not going to go in anything blind. You know what you want. You know what you want. Okay. So when you get into that, okay, so what do I want to do? Do I want to do the coding? Do I want to do the billing? Do I want to do my own business? Do I still want to put in all of these resumes? If you don't have a backup or somebody to back you up, it's going to be hard. So when you decide that you're not going to work or you're not going to do XYZ, you got to make sure you got that money. Because when it's time for you to eat and you still getting ready for your business, you still have to eat. Okay. So if you have to work 3 or 4 hours while you are doing this business, do so. Because there are a lot of things that you would need to do. Okay. So, don't sleep on the coding and doing your own business. Don't sleep on insurance, the life insurance. Let me know if y'all want to sign up for that. Okay. So these are the books that you need. Y'all know I always kind of do a rundown on the books. What I found, I was telling y'all about the syllabus. I have a syllabus already in StreamYard, so I can pull that up. I don't know what's in there. I got to look in there. But I know when we first started the classes, I'm looking because I don't see my watch. When we first started the classes, I showed y'all the syllabus. But this is kind of like the new year. This is like the first of the month. So, I want to kind of make sure you guys have what you need. Okay. Especially those of you who are walking in the classroom in a new semester. Okay. So generally, I know I mentioned semester. Generally, every 15th of the month, providers start my class. So the 15th of the month is my official start class. When I'm training providers on the coding, they start on the 15th. They have a specific schedule when I'm working with providers. When I'm working with Sapphire Academy is every 15th of the month. That's when you start. Your first week for you, first week for providers, everybody gets orientation. The providers' orientation is a little different from yours. YouTube, you have the same aspect. Okay. The only difference is yours is on YouTube. Okay. And I see a lot of people doing the archive, which is fine. And that means that you don't have like a set schedule where you have to do this or you have to do that. I do supply you with a schedule. Okay. And that's so you can stay on track. Okay. That schedule is in Sapphire. So you have to go there to get the schedule. I did do a schedule chat though. You might see a screenshot of my chats that are in one of the schedules. Okay. So I put up another book for your Hicks Picks because Amazon did not have the 2025, 2026. Bucks does have the 2026. So make sure you go on Elsevier to get that. Okay. I'm just gonna pull that up real quick. I don't know. I didn't pull. Oh no, that's not what I want. This is what I want right here. Hold on. So I'm gonna pull that up. So elsevier.com, that's where I get my books from. You also can get your books from Amazon. Amazon is my go-to early in the morning. Because I'll have, they get 25%. They'll have something off. So I'm waiting for a couple of CPT books to come in. So they do have the 2026. Okay, I'm gonna pop in here real quick. Wrong one because I need to show y'all the other one. So what I'm pulling up right now is pretty much my sheet will always give you guys the links for the Elsevier XYZ. I actually have it on here. I don't have to pull up the other one. What I'm doing is just giving you guys the link for Elsevier. And when you go on Elsevier, all you have to do is give them the ISBN number. Okay, anybody needs the ISBN number, you let me know. I'll go ahead and put that in there. Okay. There you go. So that's elsevier.com. Okay, I'm gonna put it up again because it looks like a little dash is on there. Okay, I want you to be able to, click and kind of be through with it. Okay, there you go. There you go. You should be able to click on that. Okay, so that's your Hicks Picks. That's 2025, and that's pretty much that's the integumentary system. So in Sapphire Academy bookstore, the bookstore has all of your program classes. You don't have to do the full classes. The full classes of my course is $489 and $1,389. For YouTube, you guys, when you go in there, you'll see something for $99. And that's for the advanced class because you're independent. You're literally doing it yourself. When you go to Sapphire Academy, you're going to click on something that says go to the bookstore or Sapphire Academy resources as soon as you go on my website. When you go in there, you're going to see everything in their books. I have the CPT book. I have everything in there that you need. But this is the integumentary system. Okay. You don't need to get the full program if you do not want to. Okay. You can get integumentary, you can get cardiovascular, any one of the sections for $25. Okay, so that's somebody's answer. I don't know who asked me that, but that's somebody's answer in regards to getting the whole program. Okay, so right after this, we're going to be starting classes, but I just wanted to kind of put that up there to show you what it really is. If somebody's getting a hard copy or not, because generally I can give it to them in a download immediately. Okay. So, so class starts now. Yeah, I know class is getting ready to start, but I wanted to kind of give you guys that heads up on that. And I'm going to show you that syllabus. I'm not sure what's in there. I don't remember what I got loaded in there, but we're going to look at it and see. Okay, so if you go to Sapphire Coding, again, you can purchase individual courses or you can just get the full program if you want to. Okay, but that's how you're going to access it. You go to sapphirecoding.com and you're going to click on Sapphire Academy resources. Okay, you have tests in there, you have summaries in there, you have EHR training in there, you have free books in there, you have free medical terminology book, you have automatic download, and you have one-on-one with me. Okay. And one-on-ones is consistent. You guys can talk to me whenever you want to, even if you're in a billing and coding school and you just need that extra coaching, you need that extra tutoring, you need the extra test that I have in there. You want to take a billing test. Okay. That's what I have in there. Okay. So if you guys have any questions, do not hesitate to DM me or let's take this down to DM me or well, you guys don't have discussion board. Well, if you don't, you can send me an email. My email is usually below. It's physicians@sapphirecoding.com. Okay. So now I'm going to go in here. I think I know I have other slides in there, but I just want to kind of look at some of the PDFs that I actually had in here for you guys, because we did look at a few. And who's that asked me for the syllabus? The syllabus, I think I have it in here, but first thing I want to show you is what that schedule looked like. Tanea asked me what the schedule looks like. Let me show you what it looks like. This is one we did when we first started. This is how your classes are. Your classes are going to be like this, and then you're going to check off whichever one that you did, and to kind of keep you up with it. So go back to, this is in medical billing. So if you want to even make one yourself, this is how you're going to keep up with your classes. Okay. And that's pretty much something that you're going to go by. It's not the original schedule that we use in Sapphire Academy, but it does give you kind of an insight on what we're going to do. Okay. So some of this that's in here you don't really need. It's really like a schedule that we had in here, and some of the stuff that I did in the beginning of the class. And this was pretty much, this was for YTU, and this is the kind of stuff we do at the beginning of the class. At the end of your class, let's say at the end of this class, we have a capstone. The capstone is that we kind of go over everything. Now, this was for medical insurance billing. Okay, so if you're going to do medical insurance billing, yes, there is a capstone in medical insurance billing. Okay, so this again, this is another way that I'm going to be able to give you more. Okay, but y'all got to subscribe, get your friends in. I got to hit that monetization, or it's going to take away from Sapphire Academy, and I can't do it. Okay, so make sure you subscribe and tell your friends about it. But this is how I'm going to give you more. Okay, so just kind of be precarious of that, because what we got in here, because we can give you what you need. The only thing is, we have to have the time to give it to you. Okay, I can show you many things in here. Well, we definitely going over this. This is the medical terminology book. So remember, YouTube, you asked me for tests. And again, you don't have to sign up for Sapphire Academy for the test. I purposely wrote this book with tests in it so that you will have something to test yourself on. Okay, you do need the language of medicine book with this. Okay, you need your language of medicine book. Okay, but that is the medical terminology book with the tests in it. Okay, you have to go to Amazon.com to get that book. Okay, so go to Amazon.com and you go ahead and get that book, and you guys can use the test that's actually in there. Okay, I'm just kind of running down to see what else I have in here that you can kind of get a look at to see what's in here. Okay, so again, don't forget, I'm just going to drop this up here again because I want you guys to see this. That's part of your schedule. You can duplicate that if you want to. That's up to you. But again, this kind of to help you out, kind of to keep you on track. So you guys remember when I told y'all don't write in your book. Okay, this is what I want you to use. I do have a copy of this. You guys remember this back in school when we used to take them big tests? And I don't think we had to take SAT on this. I don't know. But this is what I want you to put your tests on, because I don't want you to mess up your books. Okay. And I have a copy of this in there already, and you can even order it. I don't know where I got it from, but you can order this yourself. But this is what I want you to use to put your answers on. Okay. So even, when I give you your capstone exam, that's what it goes on. Well, with Sapphire Academy, and those who are in the Sapphire Academy who like to do the one-on-ones with me, they're going to follow the program and they are with me. Okay. They get that. Okay. But you don't have to have that. Now, we do have that other sheet I was telling you about. Who asked me about it? I'm going to do it tomorrow. Well, tomorrow's class? Tomorrow is class. I'm going to do it tomorrow. Anytime you guys see me put a time out there and I don't get to that time, that means I can't do it. I just have to change the time. You guys are going to have to archive when you don't see me on there. Okay. So again, that's what this is for. Because I know I talked about this for a minute. And every time I got ready to come on, I still didn't have it. But I said today I'm going to make sure I have that, because I know y'all wanted to see that. Some people did not know that I still use that. Okay, so this is that schedule. Okay, you see that? That's your schedule. Okay, the first week of the schedule is orientation. So when you go to Sapphire Academy, that's the first thing you're going to get. If you're not going to get the full program, you do not have to. Okay, you can get it piece by piece. This orientation, you're still going to archive it. I think it's like $40 or $30. I don't know what it is. Y'all go to the bookstore and see what it is. But again, here, you see this? This is where you're going to do medical billing. Okay, everything that you should be doing in medical billing is in here. Okay, this is medical billing. So if you see something, this is the first week, right? This is the second week, third and fourth. That's medical billing. So if your medical billing is 15 weeks, you should have 7 of these in green. When the color changes, You're in a different class. You see? And in that classroom, you should be doing this on Monday. You should be doing this on Tuesday. You see what I'm saying? Repetitious. So that is what I wanted to show you guys. And again, this is also in the medical billing class. I think we went over, I go over that all the time. We went over that in the class, so you can so you guys can go ahead and follow that. Sapphire Academy, that's where that is. Okay. This is the syllabus binder. This is not for you. This is for me. But this is how I teach you. This is a syllabus binder. Every teacher that you see in college, they're supposed to have a syllabus binder, because when accreditation comes in, they've got to see what you're supposed to be teaching. They've got to see what you're using to teach. They've got to see, are you doing the lesson plan? Are you doing the syllabus? Do you have the crosswalk? Okay, so that's what we're working with right here. Okay, this is pretty much the crosswalk of what they'll be looking for. So this is what's in your class. Okay, that's in Sapphire Academy. Okay, in Sapphire Academy, you have the tools to do what you need to do. Okay, I know, because when I first come on, I have to do this. If you need to know more, okay, because when they come, the first thing I say, let me see a mission statement. This is it. This is my mission statement for Sapphire Academy. When you go into the Sapphire Academy, you will see it. Okay, you will see the, I don't know which I did. You will see the mission statement. Okay, and the main thing is, I got it in the front. The main thing is do your work. Okay, you can go into Sapphire Academy anytime you want to, just like how we do YouTube. Okay, you do need to have the Sapphire Academy email to get in the Sapphire Academy. Okay, so my suggestion to those of you who are going further and take your CPC, yes, I think you should join the Sapphire Academy. You're still going to be doing what you need to do on your own. I do have the Zooms in there. We do the one-on-ones, especially when I think you're missing something. If you know somebody who wants to get in on the classroom, who are not familiar with medical billing and coding, yes, you need to give them yeah, y'all know that's my signature picture. Give them this book. Okay, yeah, I know. Go to Amazon, get this, or go to my website and you can order this. Okay, so that was your introduction for this class right now. We're already 32 minutes in. Let's kind of get started. So if you have your step-by-step book, you should be in your surgical section. Okay, which we've been in the surgical section for a minute, and we've already actually done this step-by-step in the surgical section. Okay, so before we even get any further down, like I said, we've already done the introduction. Okay, the ICD-10. If you need to revert back to my ICD-10 class, go to the playlist that says free classes, or go to the playlist that says coding. Okay, it's the same playlist as this. It's just probably ICD-10 15. What's the ICD-10 class number? ICD-10 class number is, hold on. So where I'm at right now, I'm actually in the Sapphire Academy. And in the Sapphire Academy, I can look in there and go to the portal. So I literally can remind myself. I can go to the shared. I can go to all of the classes. You have your summary, you have your chat links. So every link that we do on YouTube is in here. You have your books chat. You want to know what type of books. You have your syllabus for 9 weeks. You have your syllabus for 16 weeks. You have your syllabus for 20 weeks. You have your syllabus for 40 weeks. Yeah, I know. I have different classes. Some of my students are on fast track. Some of them are on the 40 weeks. That's going to take them a little longer. Okay, so your billing class is 8311A. I know you have their names. You can't do the class all over the place. So your medical terminology class is 8312A. So when you are trying to find classes that you want to study at Sapphire Academy on a YouTube, that's how you're going to find your classes. Okay. Yeah, absolutely. So your class for the ICD-10 is 8313. Okay, it's 8313. Okay. And I'm going to go back over that. So don't stress, finding too many things and you kind of get lost, because I'm gonna kind of backtrack with you. We have to go through this book, but we also have to go through some things that some of y'all already missed. But I did say I was going to go back over it, but I'm not going to backtrack today. That's going to be another day. Um, I know I got about 11 of y'all asking me the same thing about the ICD-10. It's me talking and it's archived. So I mean, I'll try to make time and kind of go back over the beginning. But I don't want to do too much backtracking when a lot of y'all are kind of moving forward. Okay, but we'll go over it. But I'll just give you kind of a heads up. Go to your CPT guide and you just start from the beginning. That's all you're gonna do. That's what we did in ICD-10. Your ICD-10 class is 8313. Okay, it's 8313. Okay. I know what I'll do. You know what? I can put the link up there. So we do tomorrow. Go ahead and put the link up there for the class. Okay. I'll check it out tonight. Okay. So today, introduction to ICD-10, that's in your CPC guide. Okay. Because that's the same thing that we're doing right now. Okay. Your CPC guide. So we did the Hicks picks, we did the level twos, we did the modifiers. That was all in the front. Okay. But we did that with step by step, remember? So if you go to your CPC guide and you go to page 81, maybe you have a different yearbook, you have a different page number. Okay. And it's pretty much you doing your guidelines. Okay. The modifiers was on that page 81. What's the page that we're going to start it on? This page is starting on 67. So you guys might have a different page. And again, we were in surgical section and we did step by step. So in your surgical section book, this is what you need to retain. This is what you need to remember. We did kind of touch bases on category 2 and 3 the other day. But when you're doing this and you see these little notes down here that say, review every guideline in your code book, underline or highlight specific coding information within the guidelines. So you guys know when I tell you to use this to highlight the codes that look the same. Okay. That's what they're talking about. And it's generally you getting used to your book. Okay. You guys remember when we talked about the category 3 and the T that's at the end of the category 3. So right down where it says below that example over there, it says category 3 CPT. Okay, and that's what we went over that last night. So you guys can actually go over that. Okay, just remember the T is at the end of category 3. Category 3 CPT codes are temporary codes assigned by the AMA for emerging technology, services, and procedures. Category 3 codes are alphanumeric with the letter T in the last position. That is crucial to remember. Okay. That sounds like something that is going to be on your test. Okay. It's going to be multiple choice. What you're going to retain is those category codes and with T. Now, when you get to your CPT book, you guys can go ahead and flip to category 3 if you want to, so you can kind of see some of those codes in there. Okay. The AMA updates the CPT code book annually. Index. When you hear me say index, that's test. Okay, so one of your questions are going to say, when does AMA update the CPT code book manual? CPT code book annually, ABCD. Okay, you want to choose that. So I will put that on an index card. Okay. See, I'm still on 67. Where it says the organization of the CPT code book, they're going to ask you that. They're going to ask you that. Another thing they're going to ask you is like how many sections or something like that. Okay. So make sure you get that. Okay. Category 2, 0001F, they're going to end with F. Once you read this first portion, which I know you guys already started reading it, I'm just kind of backtracking a little bit. Okay. CPT sections category, index. Okay. Category 1 has 6 sections. Question. How many sections does category 1 have? 6. So yes, you might get that on your test. That's why they need to make sure that you read your book. So yes, that's for your index. Okay. That's on your index. And they have them down here already anyway. Okay. So I want you guys to use your index cards, put that on the index cards, Put AMA update CPT annually. Put that on an index card because that's going to be some of your questions. When you actually get to the back of this, you're going to have tests in there. Whatever you got wrong, I want you to look in the back of your book. Okay, look up the correct question and read the rationale. Okay, read the rationale. CPT, the CPT subsections. With the other sections, we passed it. The table of contents, category T, alphabetic index. Okay, we're good right here. The CPT subsections also include indicator icons. Now, when you get your book, I don't know if you have hard copy or you have online, but I want you to get online. Okay, online. I want you to get hard copy because that's the book you're going to use for your test. There's going to be a lot of illustrations in there. There's going to be a lot of boldface type in there. There's going to be description at the bottom of your book. So you may not have too much trouble with that. But this is the deal. In order for you to know where to find stuff in your book, you have to start paging through your book. Start paging through your book. So this is for new students, because all my old students, I know you guys have already done this. Start paging through your book. It allows you to get used to what's in your book. Okay, when you take your test, you're not trying to find stuff, you know where it is. Okay, because generally you're supposed to go to tabulars and then your index, but sometimes you're not going to have time to do that. But when you get to know your book, that's when you're going to save some time. Okay, so I'm on page 68, 69 of your CPC guide. This is what you're supposed to be doing right here. And I mean, this is the best part that you're going to do. We've already done the step-by-step. You should be doing your exercises. It tells you basic information that you need to know. It's not coding, it's general guidelines, it's section guidelines. CPT, in the CPT book, the category 1, that's your main area. That's your go-to area right there. That's where you're going to highlight differences. You're going through that book page. You actually read it just like you're reading a book. 3-4 times, and you start retaining some of it. No, you ain't gonna remember the whole book, but you will start retaining some of it. Okay. So here we go. Remember, I told y'all about the 6 sections. So that was on the test. Okay. Maybe you won't get that one that has that one, but put it on the index card. Evaluation and management. Did we do evaluation management already? Okay. Anesthesia. We did anesthesia. Okay. Your surgery section. Okay. They're talking about the whole section that we're getting ready to do right now. Okay. That's your surgery section. Okay. Look at your step-by-step book and you can see the full surgery section. Okay. You can see the full surgery section. Okay. Radiology, 70,000 series. Okay. You might have a fickle with radiology. So that's where we're going to spend a lot of time at in radiology. Okay. We're going to spend a lot of time in radiology. Pathology. Yep. Pathology lab, 80,000 series. You're going to spend time in that. Medicine is going to be the most interesting because medicine has all of the issues in there. You're going to have to do the diabetes session, cardiovascular session. If you're going to work in a doctor's office, make sure you get a high score on that one. Make sure you get the highest because you will feel more comfortable going into it, especially when you're coding this. If you're just going to do medicine, doctor's office, or clinical office, this is going to be your go-to section right here. Okay, that's the medicine section. 90281, y'all can go there if you want to. 99199. I mean, you can just go to the medicine section and boom, and take a look at it. You can also go to the medicine section in your CPT guide. I think it's at the back. It is. Okay, so your medicine section is chapter 18. And this is, to me, this is the fun section because here you get to learn about the vaccines. Look at the introduction part. We just kind of scamming through immunizations, vaccines, psychiatry, biofeedback, dialysis. Everything is in here, non-face-to-face services. And this is a lot of what we saw in evaluation and management. Okay, it's a lot of what we saw in evaluation and management, but the codes are totally different. Medicine, you're talking about sickness, patients with sickness. Evaluation and management is the providers are evaluation of patients to see what's wrong with them. Medicine is not, now they going to medicine and we know they sick, but now we know where to send them. You see the difference between E&M and medicine? I know you're going to get that. You're going to get that in a minute, okay? So and that's why I try to take it slow, because there are a lot of differences in the coding. In the E&M, you have the new patients, you have your established patients. When you guys get to medicine, go to chapter 18. You have a different year, you may have a different chapter. But when you are doing your E&M services and then you're doing medicine, you will see the differences between the codes that are in there. The patient is doing evaluation. The patient is doing referring the patient. The patient is sending the doctor sending them to consultation. When you get to medicine, the patients are already sick. So, that's up to you. If you want to, work in just medicine, make sure you can master that down. Okay. All right. I just kind of jumped over there because we got to those 6 sections. So yes, that's AAPC CPC test question. Okay, so CPT, AMA annual, CPT sections. How many sections is in the CPT? 6. Okay, put it on index card. Evaluation and management. Okay, we did that. Backtrack and do evaluation and management. Okay, anesthesia, we did that. Backtrack and do anesthesia. Okay, surgery, we just started surgery. Okay, radiology, path and lab, and then your medicine. Okay, so your homework tonight is those 2 sections, because we're going to be in this section for a minute. So this one and then integramental we get ready to run to. Okay, and this is your go-to beginning. I mean, we did the step-by-step, and the step-by-step just pretty much puts you in the right place. But when you start reading your CPC guide, this is what's going to give you insight on what's going to be on your certification. Okay, and that's the reason why when I teach the coding goes directly with this book, hand in hand. Your CPT book is in front of you, your CPC is in front of you, your ICD-10, your HCPCS is in front of you. Okay, so make sure you take heed to that. I don't want to pass over this little small part right here with categories 2 and 3. I just kind of ran through it real quick with you. But in the beginning of this book, make sure you put that on your index cards, because you may need that. Okay. The CPT, you know what CPT 1 is, the category 1 codes. 2 and 3 we just went over. Okay, so just kind of be precarious to that. There's the T at the end and the F at the end. Okay. But I do want you to go over that. So in your book, I'm in the CPT book right now. Okay, and you should have your step-by-step book in the same section. Okay, but make sure you get those 6 sections down. I'm pretty much just pointing out some of the short views that are in here that you should be looking at anyway. Testing technique. Always use that testing technique. Make notes in your CPT book. Y'all heard me say that many times. Okay, for easy reference and information found in the CPT assistant. That's just the online thing. But in your books, try to keep your notes this small. Don't put nothing in there like that, because the proctor is going to say, okay, she got too much in here. You can't take. You need to get you another book. Okay, don't put too many notes in your CPT book. There's a section in your book and where there's a clear page in there. You might have 4 or 5 of those clear pages in there. The ICD-10 has the same thing, where there's a couple of clear pages in there, and they're for you to put notes. But you don't have to put them there. You can put your notes wherever you want to. If you have, when we get to musculoskeletal system and you want to put how many bones in a certain spot where you can get it. Okay, because that's going to be in the illustrations. That's going to be in the illustration. The illustrations are these. This is illustrations, but they're going to be in the front of your book. You see these pictures and things like that. This is what we call illustrations. So on your exam, it's going to say, what illustration is this? And then it's going to be multiple choice. But you're not going to have to bang yourself in the head to do that. I can't lift that book. It's just too heavy. Your illustrations are going to be right in the front, okay, of your book. Your ICD-10 has illustrations. Your HCPCS has illustrations. I think I did a chat on illustrations. Your CPT also has illustrations. And those illustrations are going to help you. And I'm telling you, AAPC, they pick stuff out of each one of these books. They pick stuff out of the books. That's how they make the test. Okay. They testing you to see if you actually read this book. All right. So separate procedure. Okay. A designated separate procedure should be reported only when performed alone or when the service or procedure is unrelated to the other service or procedure provided on the same day. Okay. In the latter case, modifier 59, distinct procedure service may be required if so. Make sure you read the modifiers. Let me see what page they are. I want you to go through all the modifiers. Page 79. Okay. They're on page 79. The modifiers are in your CPT book. They're also in your CPC guide. So when you get your CPC book, because you're already studying them, what page? Mine is on 77. Because you're already studying them, you'll know what they mean. Okay, I'm just kind of skipping through. This is your homework that you're going to do because we already pretty much did this. Okay, so the modifiers are appended to the CPT and HCPCS level 2 codes. Remember the modifiers that we were looking at when we were in anesthesia? Don't forget to look at those P1, P2, P3, and then their AE, AH. There are a lot of them in there. You guys are going to look at that as well. Okay, so again, level 2 code booklets, modifiers, and the description. Okay, make sure you know what appendix they are in. This is a question. What appendix are the modifiers in? They're going to have multiple choice. Okay, and then you're going to take a minute and start changing the page and look for it. We're going to eliminate that. Appendix A lists CPT modifiers and includes a wide range of modifiers. You put it on index card, put down which appendix has what. That way, if you can retain that and you get that question, boom, you know what it is. And it'll save you time from, okay, you know you got your book in front of you. You know the answer is in the book, but you got to have a clue of what it is so you can bump through that test. And then when you get your bigger cases, that's where you're going to need your gusto time. Okay, you get those bigger cases. Okay. So Appendix A lists CPT modifiers and include a wide range of modifiers, including those used for anesthesia and modifiers responded by ambulatory section, and hospital outpatient facilities. HCPCS level 2 are usually located in appendix of the HCPCS level 2 book. So that's the reason why we did the HCPCS in the anesthesia. Okay, that's on page 77. Okay, I don't need to read the whole thing. I want you guys to do that. So, here's a good one right here. So, this is on my still page 77. HCPCS level 2, they've got the upper eyelid, lower eyelid, upper right eyelid, lower eyelid, E1, E2, E3. That's in your HCPCS. Okay. But again, just keep everything in front of you because even like we're here, modifier 22. They love using modifier 22. And sometimes it's not necessary because they probably got the wrong code. Okay. Increased procedural services. That's modifier 22. Okay. When you read those notes, and maybe he put that, and maybe you as the coder read the notes and say, all right, so now I got to tell Dr. Jones he can't use the 22. I got to change the code. And the first thing they do is come to me, Miss Lambert, she changed my code. And then you know what I'm going to say? We can't use codes from 10 years ago now. I ain't going to say it like that, But that's the first thing that happened, And when you fix a doctor's code and they're used to just putting the wrong code anytime, they get it back. It goes to billing, goes to AR. Then finally it'll come back around to the coding department. So that's why I'm trying to tell you, when you do your modifiers, make sure you know about them. Make sure you know which one to choose. Read your provider notes and make sure he's using it necessarily. So when I say 22 increased procedural services, there's a whole list of reading behind that. Okay, you're going to do that for your homework. Okay, 23, unusual anesthesia. Okay, when a procedure that usually is required, either no anesthesia or local anesthesia, must be performed under general anesthesia due to unusual circumstances. So it's not just unusual anesthesia. They got a whole bunch. That's just a little bit that I just read. There's a whole bunch behind there. The gist of me saying that was 59. 59 is one we use all the time too. That's just a sample of what you're going to do. Okay, that's the one we were talking about with the 59. So if you want to look up the 59 distinct procedural service, go ahead and look up that in your book. Okay, so those of you who don't have your CPC guide, it's in your CPT book. Go to the modifiers, you will see it in there. Okay, and all of them. Look up all of the modifiers. 62, you might have two surgeons. Botched. I was watching that today, and I mean, they had three surgeons working on her. I mean, I thought that was. Now I know two, usually do, especially in ortho. It's always two doing the surgery, but this time this one was a surgical facial procedure, and there were three surgeons working. 62 is two surgeons, but again, I'm just trying to give you a word to the wise of what you might be going through when you are doing the coding. And 62 is one of those procedures that you're going to see on a regular basis. Okay. So again, if you don't have your CPC guide, go to your CPT book. This is in there. Okay. This is in there. Whether it's hard copy or, or whatever. So these are, so I'm on page 83. So all of them, I think there might be 25 or 30 regular modifiers. But as far as the Hicks Picks level 2 modifiers, okay, level 2 modifiers BO orally administered. E2 lower eyelid. We went over that. GU waiver of liability statement issued as required by payer policy routine notice. Now, some insurances do have that, some of them don't, but they are going to give them that at the front desk. You see that code, the patient already has that, which that's not for you. That would be for the billers, okay? And most of this would be, what I'm looking at right now would be for the billers, okay? This is for you, left side LT. Okay, which side did the provider work on? Okay, TC, technical component. We use TC mostly in the x-rays. Technical component is, let's say the patient came in for services at the hospital and they own the equipment. Okay, the TC would go on there if the doctor owns the equipment at his physician office. Okay, just kind of read this and then you will kind of get that in here. The TC is for technical component. Okay, the technical component, and then they'll give you a whole bunch of, I know I can't read it word for word. I know they got to read it. 9208. Okay, I can't read the whole. If I read the whole thing word for word, then I will be copywriting for sure. Okay, so this is not my book, but I'll put y'all in the right place. Okay, so and then we get to pretty much the glossary. Okay, add-on code. What is an add-on code? It's in your book. Add-on code, CPT code used to report a supplemental additional procedure appended to primary procedure. Okay, so there are a lot of glossaries here, and what I like to tell my students is to go ahead and put the glossary down on an index card. What else is in here, real quick? I can give you. They might ask what CPT is. Y'all know what CPT is, okay? Current procedural terminology. Okay. A code set copyrighted and maintained by AMA. AMA is the only ones that make this book. There's no AAPC. There's no, Elsevier. They are the only one. They have to get permission to sell that book. Yeah. Okay. So global surgery, global package, the period 0 to 10 days. If the patient comes back within that third day, it has to be added into the package. Okay. And that's right here. I'm on 83. You guys can read that and kind of get the retrospective to that. Let me see what else was. Status indicated. I want you to read that. But as you can see, it's really not that much. I thought Moles would be in here, but Moles is going to be in integumentary. I wanted to show y'all about the Moles and see what that is. Okay. major surgery, minor surgery, resource-based relative value. We going into that resource relative based value. We did that in medical terminology. Okay, I got 1 minute left. You got to be you serious? Oh my goodness. Well, we're finished with this one. Okay, tomorrow we're going to do your second portion, your third portion of this. That's integumentary. So we are now down to National Corrective Coding Initiative. Make sure you know what that is. NCCI. Okay, make sure you know what that is. Okay, I'm on page 84. Okay, relative value units. Make sure you know what that is. CMS reimbursement, physician Medicare services. Okay, make sure you know what that is. It's part of your test. And what you see right here, some things that are related to medical billing. Okay, some things are related to medical billing. Chapter overview. So which anatomic site would you look under the CPT? Yes. Okay, so you will do the back of your book. Here's the questions. Now, there's only two code sets in the back of here. Let me see. 9 and 10, two code sets. But I want you to go ahead and look at that. And then whatever you get wrong, where is it? Look at one of my chats. I think I have a copy of this in there for you. Because I don't know how to load this. I'm gonna try to. Maybe I'll try to scan it and put it in there for you. But I also made another sheet for you guys that you can use to put your tests on. But that's for medical terminology. It's not for this. Okay. But you could always put your answers on a piece of paper. Okay. Um. Okay. And then we're going to do chapter 5. That's tomorrow. We're gonna do chapter 5 tomorrow. I'm already in. Okay. Um. So start working on this, and then we'll continue on. We'll continue on that segment right there. But I want y'all to kind of get the gist of what this is about. I know Tatiana asked me about the ICD-10. Okay. No, I'm gonna go back through it, and then I'm gonna put that link in. I'll put the link in there for you. I don't know why it's drying here. Excuse me, y'all. So just make sure you guys do that reading, and make sure you have see, we've already done the front of that, so I can't really go back over that full part right there. But as far as the surgical section, I want you to make sure you do that. Medical terminology, we've already went over medical terminology. Use what's in this medical terminology book. Okay, use what's in this medical terminology book, because it's going to help you. Okay, let me see what else is in here. Okay, so that's it for that section. So tomorrow, we're going to start an integumentary. I'm gonna try to put a little session to do the ICD-10. Not necessarily review, but I'm gonna spend about 10 minutes on that, and then we can kind of move over. We already did integumentary. You're just picking it up from your CPC guide. That's all you're doing. You're picking it up from your CPC guide. Okay. There's not many codes in this section 4, so it's not something that I'm gonna, that we got to really go into. Integumentary should have cases in there where we could at least do a case or two. Okay, so I do want y'all to start doing that coding. Okay, let me see. Yeah. So yeah, I'm going to do something on mode. So 4, I'm on page 99. Number 4 is coding. Number 5 is coding. So you got a couple of cases in here. Oh, yes, these are the cases. These are the cases we are going to do. So make sure you go through the incision cyst left or up. Left upper back. I want you guys to do that one. So that's actually 2. 1 and 2. So that's 2 procedures there. I wonder why they didn't put the diagnosis in the front. They always do that. Okay, so if you can do 1 or 2 on your own, do it. But right now, I just want you to do the chapter 4. I just want you to read your chapter 4. Those of you who missed some of the beginning of these chapters, you can read the business of medicine. Go ahead and read the business of medicine. Okay. And if you are not sure what the RBRVs are, go to medicine. Go to my medicine chat. That's where we went over that at. Okay. Go to my medicine chat. Okay. My medicine chat, my medical billing chat. Category 1, category 2. Go over that. Okay. we're in the CPC guide. Go over introduction to ICD-10. This is for people who missed the first part of the coding class. This is for people who missed the first part of coding class. So you're going to go over that. You have your step-by-step book. Let me just look in here real quickly. Where is it? Let me look in here real quickly. And it's pretty much the same thing. In your surgical guidelines in your CPT book, we talking about the same stuff: surgical section, general sections. In the chat we did, I think 2 chats ago, will show you about the subheadings. Okay, if you stuck on that, I want you to go back. Okay, because you have to know how the book is structured. You have to know how the coding is structured. Okay, in your CPT book, you see subheadings, right? You see headings, you see subclassification, you see all those different things. Okay, same thing in ICD-10. So that's also in here. I'm on page 360. I'm on 360 in the step-by-step book. But here is where we start talking about section, subsection, subheading, category, subcategory, and notes. So if you get that on a test and it says, what is the format of CPT? Section, subsection, subheading, category, subcategory, notes. You don't have to worry about the notes. Okay. What section? That's in 360. It's in the surgical guidelines of the step by step. So again, put them together. Put them together. Your CPC, your step by step. You working with that complicit. Okay. I just kind of backtracked a little bit for some of y'all who are coming in the classroom now. Okay. Unlisted procedure codes. Make sure you guys have done that. Okay, we did that already, but we just kind of backtracking. This is your homework. All this is together. Okay, I'm just kind of backtracking for some who may not have gotten it in the beginning. But again, go to the beginning of your coding class, step by step. Okay, nervous system CPT. Make sure because we are training, you go to your tabular list and then your index, okay? Because we're training. Once you kind of start getting savvy with that book, you should be okay. Okay, you may not have to do that because you're going to have to figure out a way how to be a little bit faster on your tests. Okay. And what time is it? It's only 5:07. And what I'll probably do is come back in. I might come back in at 8. Okay. And we can do the other half of this that I wanted to do. Because I don't know, we got through it so fast, but I still have stuff that I wanted to put up there for you. But again, if you don't have your CPC guide, try and get your CPC guide. Okay. They have it. Thrift.com may have 2025 or 2024 on there. You guys get it, or you guys go ahead and go to Amazon.com and you guys go ahead and get that. Okay. I'm already 10 minutes over. Okay. But again, we're in the surgical section, and this is where you're kind of learning the gusto of the surgical section. We've already did E&M. You guys should be okay with that. Okay. Make sure you do the questions that are in back of the CPC book. Okay, so I can do an extra little session later on just to kind of go backtrack. That won't be one of your classes, but I want you to go through your CPC guide step by step, just like how we go through the CPT book. Okay. It's just telling you about your study guide. Make sure you hit the business of medicine if you have not done the billing class. Okay, because it still will ask you, what is medical coding? What is medical coding? Okay. What is it? Okay, that might be one of your questions. Okay. I ain't giving away the answer because that's in your book on page I don't know what, page 9. Okay. The acronyms that are in here, make sure you get them: ABN, AMA, APC, CMS, CPC, CPT, DLG, EHR. Okay, make sure you get them. Put them on index cards. Okay, RBRVs. Okay, VS. Okay, RVU, relative value unit. Make sure you get that. Okay. Remember, I told you about the MAC. There's 2 different MACs, so be careful with that. Medicare and administrative contractor. Okay, be careful with the MAC. Okay, monitored anesthesia care. Okay. So get these down. So you guys got plenty of time. I still may come Monday. I need y'all to get time and get this down. And then let me know how y'all are doing. Let me know, how you are going in your own study. Let me know how you're practicing. Let me know, if you are getting some of the coding. If you are, oh, that's how we do that. Oh, this is how you do this. Or, send me a DM on what else you want to study. Okay, send me a DM on Miss Lambert. We should do this. Miss Lambert, let's try doing this. You know what, Miss Lambert? Some of that I'm not getting. So you know what I'm saying? It speaks to about reading. You're really just doing a lot of reading. Okay, but the second chapter, integumentary. Now you're going to do big cases. Right now we're kind of doing small cases, and there's two at the end of here. But we can't start that until you good with how to code now, because we went over all that, right? We went over all that. You need to know the modifiers, right? Before you even hit the codes, go to your modifiers section, your prefixes. This all was in medical terminology, but this is just another go-to. Synthesis, suffix, punctuation, ectomy, graphy, pexy, plasty. You need to know what those things are. You remember we went over that. Those things are in your medical terminology in your CPC. Okay, so that's what you're gonna need to do. All right, so I'm signing off now. I'll see you guys tomorrow. I'll let you know when that chat is going to be. You see that thumbnail? That's when that chat is going to be. Okay? Study. Bye.